Hi, my name is Jesse Rose. I'm presenting my project on stuttering, using a volunteer playing a stuttering patient to help carry out my presentation. The presentation revolves around my inquiry question. How do everyday social interactions differ for individuals who have a stutter than for individuals who do not have a speech disorder? What is stuttering? According to the American Speech Language Hearing Association and the U.S. Department of Health and Human Services, stuttering is a speech disorder. It is characterized by disfluencies, which are disruptions in the production of speech sounds. Most often, sounds, syllables, and words are repeated or prolonged, disrupting the normal fluency of speech. It is not uncommon to see stuttering accompanied by rapid eye blinks and lip tremors. There are three primary behaviors of stuttering: prolongation, repetition, and blocks. Prolongation is prolonged speech with certain sounds. I have my volunteer here to give you an example of prolongation. What is your name?
Megan.
Repetition is repeated speech sounds. I have my volunteer also here to give you an example of repetition. What is your name?
Megan.
Okay. And blocks are when the mouth is positioned to say a word or a speech sound, but the articulators can't seem to get it out. Usually the mouth and lips tighten. I have my volunteer here to also give you an example of blocks. What is your name?
Megan.
Okay. Now that we have a brief overview of stuttering, we're going to answer my inquiry question. To reiterate my question, it stated, how do everyday social interactions differ for individuals who have a stutter than for individuals who do not have a speech disorder? In most cases, stuttering has an impact on at least some daily activities. Simple everyday tasks and social interactions are often overlooked by people who are capable of speaking fluently. Have you ever thought about how easy it is to order a pizza? Let's take a look at a normal interaction.
Yeah, hi. I'm just calling to place an order for a large cheese pizza. Okay, name's Megan. Springfield College. Oh, 20 minutes? Oh, that's great. Okay, thank you. I'll meet you outside. Thanks. Bye-bye.
As you can see, it is very easy for someone who is fluent or without a speech disorder to do something as simple as order a pizza. But is it as easy for someone who is disfluent or has a speech disorder? Let's take a look at someone who stutters while they try to do this simple task.
Hi. Uh, um, um, I'm just calling, uh, to order a large ch- cheese pizza. Springfield College? Oh, okay. Okay, sorry. 20 minutes? Uh, Thank you. I'll meet you outside. Bye.
Some specific activities that a person might find challenging to perform vary across certain individuals. Communication difficulties only happen during specific events, like talking on the telephone and ordering a pizza like we just saw. In some cases, the individuals are very concerned with what others think about their disfluent speech, and they become anxious or insecure, creating even more difficulty. Other people may try to hide their disfluent speech by substituting difficult words or pretending to forget what they wanted to say, or even just declining to speak. Clearly, the impact of stuttering on daily life can be affected by how the person and others react to this disorder. Now, a few tips on how to get about communicating with someone who has a stutter in a social situation. It is extremely important to be patient and let the individual finish what they have to say. Interrupting may cause even more anxiety for the individual, worsening their disfluencies. It is also very important to encourage the individual and to have them say what they feel, even if they feel the inability to say it. To conclude my presentation, I will talk about individuals who have a stutter and are seeking therapy. What they can do is see a SLP, or speech language pathologist. Most treatment programs with a speech language pathologist focus on improving oral communication. They focus on helping the patient control and monitor the rate at which they speak, which is very important for people with a stutter. They also teach them to control and monitor their breathing. They will practice smooth, fluent speech at rates much slower than typical speech. Over time, people learn to produce smooth speech at faster rates and longer sentences. Follow up or maintenance sessions are recommended to prevent relapse in these situations.